Hi everybody out there in YouTube land, this is Norma, and today I'm doing a video response to Gastricrose, Rosemary's video where she's trying to help one of her friends who had surgery, weight loss surgery, and is having problems with her hair. Okay, after being out more than 2.5 years, this is what I've been doing over a period of time. Okay, it's not every day, but I know that there's a necessity, and I know that Gastric Rose did this video for me too because she knows how I feel about my hair loss that I had. I had a lot of hair loss, and I mean, these are some of the things that I have bought over these past 2.5 years to help. Okay, these, my friends, is not a wig, but they're little wiglets, and I bought them from Tony Bradkin. She sells them on HSN, and she also sells them through Avon, and I believe she sells all different kinds of things. Well, okay, if I had brown hair, which I don't because I'm a girl and I like to change my hair color, okay? My new hair color is just brown, light medium brown. But this is when I went through my dark hair brown. And these things, you put them in between your hair and it makes it kind of thicker. And let me show you how they work, okay? You put it under your hair and you just take them off like that. And they have these little combs that you snap them shut like that and then you just put them away. I'm going to take these off because this is not the only thing that I've invested money in to help me with my hair. Mind you, I've worn these one time for you guys. I haven't worn these because I don't feel good wearing these things. I don't know. But you know what? I think that sometimes you have to go through these things in order to figure out what is right for you. This is not right for me. If my hair was longer, maybe. I've always had my hair long. And up until I had surgery, it's been long. As you can see, I do have some areas where, you know, with thinning out. But you know what? It's getting better, and it's getting better because I've been taking care of myself, not just with biotin. Let me show you what I bought on HSN. Healthy hair, skin, and nails, and it comes with plus EGCG, and bioflavonoids. Okay, let me read the back. It's by this doctor. His name is Andrew Lessman. Andrew Lessman. You can actually go online and order from him. These were not inexpensive. This was a big giant thing of 600 easy to swallow capsules. And let me show you what they look like. Let me see if I can get it out there so that you can see. Okay, they're little capsules, and you could take 2 to 3 a day. I personally take 2 a day. And let me tell you what they contain. They contain vitamin A, 1,000, which is 20% of your regular needs, vitamin C, vitamin D3, B1, B2, niacin, vitamin B6, folic acid, vitamin B12, biotin. That's one of the most important components, and it has 3,600 mcgs. That's 1,200% of your daily needs. So it's a lot. And then it has um, pantothenic acid, calcium, and it has citrus bioflavonoid complex, green tea extract, silicone, and all these other things that are necessary for your nails to be stronger and your hair to be stronger and your skin to be a little bit more healthier. Let me tell you, I have noticed, and I'm not kidding you, because I've taken them I took one whole bottle once for about 4 months. Then I stopped for about 3 months, and I could tell the difference. My nails are stronger. They're not as brittle. They just grow. I mean, super long. I have to keep trimming them because I work with children, and this year I had kindergartners, so I had to keep filing them down because they keep growing. And my hair, it's starting to, okay, right here, I promise you, you guys, except for the gray hair there, okay? I promise you I was having a hard time with some areas, and the hair is growing out. It is growing out, and it's fuller, and I could tell you that it's a lot fuller. You know, I'm playing with it, I'm making it more poofy, but it has come a long way from before. Now, I could tell you one of the things I've used is headbands to cover up this thin spot, so make these thin areas when you are just out of surgery and you're hassling with this. Get yourself some headbands. There's some real cute headbands, different colors. I have at least 500 headbands, soft ones, and then I have the hard ones. I have another 200 of those and different colors because I like to wear different kinds of clothes, and of course I have those. But yeah, these little things, there's some of the things that I have bought, and I bought the other kinds of things that you can put your hair up in a ponytail. If you don't have that much hair, and you can put this on there, clip it on, it clips on in the back, and you could have a ponytail. And then of course, I have like 3 wigs. Let me show you some of them, okay? Because I bought them, haven't worn them. I worn the one that's brown, dark brown, and it kind of goes down here, and you can see it on my first video. But let me show you some of these, how they look, and how you could put them on really quick. But reality, you guys, okay, I might be able to wing it, maybe. I might be able to. I'm not suggesting that it's right for everybody because it's not, oops, it's not right for everybody. Some people, it's okay. I'm not, saying that people shouldn't wear wigs. A lot of people do, you know. This one was, okay, when I was having my hair frosted and I would go in there every 2 months and do this. My normal hair was like this, and you can see it in some of my videos. Okay, there you go. See? What do you think? You like it? Kind of flippy. And I don't know. Maybe it would be okay to wear it just for fun, but I don't want to do it for the wrong reasons, which in my case was because of the hair loss that I had. And I had a lot of hair loss, but now, like I said, I'm improving, doing better. So what do you think? You like this? Maybe to Las Vegas, huh? No, I'm teasing. Okay, let me show you the other wig that I have, okay? Because at least I should get my money's worth. Give me my wig, dog. No, stop pulling my wig. My dog is pulling my wig away. I guess maybe she doesn't like it. Wait! Take my wig from them, Nathan. That's your plan? Can you get it, please? Throw it over there. This is not a toy. Can you believe it, guys? Okay, my dogs are trying to take the wigs away and they're playing with them. At least I'll get my money's worth that way, huh? Okay, stop it. Okay, all right. I was wondering why they're so funny, these dogs. Okay, now, when I look at this wig, and I put it on, and I played with it, and I thought about it, and I'm like, okay, well, maybe, it's sort of something kind of, you got to get used to it, Seriously, you got to get used to wearing this kind of stuff. I guess if I was going to go somewhere and I wanted my hair to be a little longer, wanted to look different, maybe a different kind of situation. I guess it would be all right. But, you know, after buying these wigs and the other ones that I have, like I said, they're okay. For some people, they're okay. It's all right. It gets them getting used to it, because I don't like things in my hair. I don't know. What do you think? Okay? This is the real me. And you know what? After trying all those wigs and buying some of them and making mistakes, because I mean that's a learning thing. You have to learn to see what you like and say, okay, this is for me and this is not for me. Okay, this is one of those not for me. I like this better. It's me. This is me. This is my real hair. It's getting better, and thanks to this. Now, I think there's a money back guarantee on this. But yeah, you can get it through HSN, which is nationwide, or you can go into Andrew Lessman, and he's the founder, and it's unsurpassed purity, quality, integrity, effectiveness. And they suggest that you take 1 or 2 capsules a day. He's a healthcare professional, and this product is very effective. And you know what? I could really say that this has worked because ever since I started using this, my hair's coming out thicker. Um, maybe another thing too is I was a diabetic before, and my hair was thinning because of that. But I'm not a diabetic anymore. At least that condition has been resolved. And since taking this, and it's resolving itself. I have more hair. It's thicker and it's fuller. And I think this year I might let it grow out a little bit more. Although I can tell you that one thing is I don't like the hair on my face. So I don't know. I hope that this has helped someone and that you guys are at least aware that there are some things that you can take internally besides the wigs and the wig pieces that you can use. I mean, those are fine. If you like that kind of thing, they're fine. It's like whatever you like that suits you the best. But me and my lifestyle, this is good. All I do is wash and wear, fluff it up with my fingers as it's drying as I'm going to work, and I'm on vacation right now. So you're going to see a lot more videos from me because I have been working on my weight loss again. I did gain weight, and I'm trying to at least go down maybe 10 pounds. I was going to try to lose 20 pounds, but you know what? No. I wasn't feeling okay at that weight, and I don't mind if my BMI um, uh, says that I'm overweight. It's okay. It's how I feel inside. So I think if I lose 10 more pounds, I'll be okay with that. And I'll still feel healthy and I'll still feel good. Going to do a lot of biking this summer, a lot of walking, especially in the malls. And I'm going to eat right, which I have been. If you guys saw my video before, I found some really good buys, and it's just a thing of going out there and looking for them and knowing where to look. And you know what? Encouraging your family to also follow suit with you. You make the choices of what you're going to cook. You make good choices for you and your family. And yeah, that's hopefully that will help. So remember, if you can find this and if these are a little too pricey for you, buy a tin. It'll help a lot. And then those other pills that are around for your nails, you can go to your pharmacist and ask them. They do have some gelatin um, pills that you can take for your nails, and that's going to help your hair and your skin. And I can tell you that this old lady feels pretty good. So there you go, Rosemary. I know that this was done so that I would come on and talk about how I felt about my hair. And let me tell you, it was really bad. Yeah, it was really bad in the beginning. I lost a lot of hair, but I'm okay because it's coming back. And just remember, another thing you have to do is make sure you get those 64 ounces of water and that you're getting at least 100 grams of protein. I know they say 60 to 70, but 100 grams is just for safekeeping. Just make sure that you get that protein in so that way you don't have to deal with all the hair loss. And in the beginning, sometimes there's nothing you can do about it. It's going to happen, but it will come back out. So you have to just keep taking care of yourself and making sure that you're taking some kind of biotin and that you're following suit with that and your protein. As long as you're doing all the right things, there's no reason for your hair not to come back out. Okay? If you are losing a lot of hair and it's not coming back, look at what you're eating. Are you getting enough protein? Are you taking that biotin? And like I said, this stuff I really, really like this stuff. It's working really, really well for me. My nails, like I said, my skin, my hair, all of that is coming through, and I don't know. Let me see. There's the guy. There's that guy. And I can reorder. There's the number if you want. You can visit www.hsn.com and you can ask for these. His name is Andrew Lehman. Okay, and